Thank you, Madam Speaker, for the opportunity to deliver my ministerial address. This afternoon I'll be providing an update on the work undertaken by the Ministry in terms of occupational health and safety and also workers' compensation services in Fiji. This is quite important this week because towards the end of this week we will be celebrating World Occupational Health and Safety Day. Madam Speaker, the International Labour Organization has highlighted that every 15 seconds around the world, a worker dies from either a work-related accident or disease. And every 15 seconds, we have around 153 workers having a work-related accident. This is quite an alarming statistic. While we do not have the statistics for Fiji per se, that in itself is something of concern. Every day, 6,300 people die as a result of occupational accidents or work-related diseases, which are more than 2.3 million deaths a year. The ILO has estimated that the annual human cost and economic burden of poor occupational health and safety practices is approximately 4% of global domestic product. So that provides for us an indication of what we could save in terms of cost of GDP to GDP if we were able to minimize and prevent workplace accidents and illnesses. So this is something we need to create a lot of awareness on. Here in Fiji, we have been undertaking a lot of reforms in the sector of occupational health and safety. This resulted in 1996 in the enactment of the Health and Safety at Work Act and also the establishment of the National Occupational Health and Safety Service in 1998 under the then Ministry of Labour. This reform that took place during that period resulted in our replacing the outdated Factories Act and its Factories Inspectorate Agency, the changing of the operational management and systems and culture at that time. The National Occupational Health and Safety Service that we now have is certified to the ISO 9001-2008 Quality Management System. The current legislation that we have, Health and Safety at Work, it provides us a way to be proactive in response to occupational health and safety and to prevent work-related accidents and injuries, disease and death through training and awareness, and also give us a framework to investigate such incidents when they do occur and prosecute if this is necessary. From 2012 to 2016, the most reports of work-related incidents was in the area of injuries at work. Injuries at work, with a total of 5,674 cases. Over the same period, there were reported cases of 119 occupational diseases and 30 workplace-related deaths. So in Fiji's context, this equates to approximately 94 workplace injuries occurring every month, or 3 injuries per day, 2 workplace illnesses per month, and 1 workplace death every 2 months. And as a government, as a society, this is something that we are concerned with and that we need to focus on. We know that the prompt and early resolution of OHS issues and complaints will greatly reduce serious accidents and fatalities in the workplace, in particular where appropriate risk control measures are put in place. These measures will include awareness training, targeted inspections for high-risk industries in particular, and enforcement through the issue of legal notices and taking non-complying employers to court for breach of the law. Madam Speaker, irrespective of the size or location of any organization, workers in all industries are potentially exposed to workplace dangers that can threaten their health and safety. In some industries, the dangers are evident by way of exposure to harmful chemicals, fires, explosions, and breakdown of machinery. These are just some of the health risks that workers can face at work. In other fields of work, however, the health and safety dangers may not be so obvious. These may be in cases of those who are working in an office or a restaurant, which may seem harmless, but poor ergonomics, food contamination, and psychological stress can also cause health and safety problems that can hamper productivity. Given that hazards are present in industries directly or indirectly, it becomes essential for organizations to provide health and safety training for their workers and to be updated on occupational health and safety knowledge on a regular basis. Madam Speaker, this OHS training is a legal requirement under the Health and Safety at Work Act of 1996 as part of the duty of employers to its workers. So they are obliged to make sure that they provide that training for their workers. The main objective of the training is for workplace stakeholders, including employers, self-employed persons, those in control of the workplace, the manufacturers, the suppliers and installers, and the workers to understand their roles and responsibilities for each person in the workplace and their duty of care. Such training has to include a number of things. The issue of best practice that stresses the importance to workers of the best work methods and procedures whilst communicating to workers of the commitment the organization has in regard to high performance standards. Secondly, such training must cover and address the issue of compliance. This component enables the education of workers in industrial and enterprise agreements, ensuring that they are compliant with all relevant laws, regulations and codes of practice. Third, it's an issue also of increasing productivity. This component focuses on the quality of work produced. It also increases the efficiency in which the task is completed. This is to reduce rework and save costs so that more time and effort can be placed on the job at hand. And the fourth component is reduction of costs. This component focuses on reducing work-related injuries or accidents, reducing overall costs associated with the cost of injury, illness, death, damage to equipment, higher insurance premiums, staff turnover, and also delayed deliveries of products and services. And fifth, risk management. This component focuses on the process of identifying, understanding, and eliminating risks within the workplace. Madam Speaker, the Fijian government believes that education in OHS is an effective preventative tool, and that is why over the last 5 years, 555 trainings have been provided, covering almost 7,000 employees in different sectors. Government believes that educating workers on the basics of OHS and prioritizing health and safety at the workplace can help reduce workplace accidents and injuries, saving organizations from costly financial and productivity losses. Madam Speaker, in ensuring that OHS and workers' compensation in Fiji is relevant and applicable, the Bainimarama government has undertaken a number of amendments to the law. Firstly, compensation for work-related deaths was recently doubled from 24,000 to 50,000 to ensure that dependents of a deceased worker are adequately catered for in light of economic and social factors. Recently, the laws on workers' compensation has been further amended to ensure that workers receive consistent medical assessments in work-related injuries and deaths, as medical practitioners that carry out assessments must undergo the relevant training. The amendment also allows for an expansion in the period of notifying an employer on a claim for compensation. This has been expanded from 12 months to 3 years, ensuring that workers are not prejudiced by time limitations. There is also allowance now that workers can apply for compensation even after leaving their workplace. Further, demand notices can now be provided to employers to provide information and documents leading to swifter movement of cases for the benefit of the worker. Another area in which improvement has been made is the recognition of occupational diseases. The list of occupational diseases has been reviewed, as the previous list had remained unchanged from the colonial era. The list of occupational diseases now captures new or emerging occupational diseases not previously captured in the law. Madam Speaker, the new list includes a range of internationally recognized occupational diseases, as well, for the first time, mental and behavioral disorders. At this juncture, it is important to highlight the need to move towards a more sustainable and fair workers' compensation scheme that ensures social justice to all injured workers or to the dependents of workers who had lost their lives as a result of workplace accidents or disease. Madam Speaker, under the current workers' compensation scheme from 2012 to 2016, figures show that only 13.3% of the total injured workers in the private sector had received some form of monetary compensation. This compares quite poorly to the 83% for government workers who were injured in the same period. In this same period, in terms of death cases, only 6.4% of dependents of workers in the private sector had received compensation, compared to 53.4% of dependents of workers who work for government. This is an area that we intend to address to ensure that an equitable and viable system is implemented. Madam Speaker, under the occupational health and safety, there is not enough awareness and understanding of the H in OHS, the health, occupational health. It is often seen as synonymous with occupational safety, but it is something that we need to take cognizance of. And in particular, I think the issue that something that we need to take particular concern is the issue of non-communicable diseases that is affecting the impact of the productivity of our workforce. Here in Fiji, we have the second highest rate of diabetes in the world, 15.6% of adults. So it's affecting a significant portion of the people sitting in this room right now, and also the people that we depend upon to work in the places that in which they are occupied. And the important thing about this is that 80% of NCDs are preventable. 80%. 4 out of 5. High blood pressure is increasing. 30% of Fijians are obese. And the worrying statistic that I have seen, that we were presented in a workshop which all members of parliament went through, is that 97% of all adults in Fiji have moderate or high risk of dying from NCDs. 97%, Madam Speaker. So it is something that is phenomenal in nature and something that we need to get to grips with. His Excellency the President had related that the World Health Organization had reported that the economic burden of Fiji from NCDs would amount to 443 million by 2030 if the trends continue. And the biggest impact of this is on the productivity of labor and early deaths. Madam Speaker, I had one other statistic here, one other point that I wanted to highlight. The World Economic Forum, which is a gathering of global business leaders, identifying the most severe threats to economic development in the world. They did not talk about change in demand or technology and all of these things. The World Economic Forum in 2010, it pointed to non-communicable disease as the most severe threat to economic development. Not a severe threat, but the most severe threat to economic development. Some studies have been shown in 2011 that a 2% decrease in NCD risk leads to 1% growth in our economy after a decade. So as we talk about occupational health and safety, we should pay special attention to the health of our workforce. And this is something that all of us, in our own individual capacities, in our own organizations, need to pay attention. It's not something that we can just let slide and hope that people make the right decisions, because the impact is going to be economic, as have been highlighted by the points that I've just been making. Madam Speaker, the last component of our labor reform that is due for modernization is our workers' compensation legislation. While the operational management system of the workers' compensation services is ISO 9001-2008 certified, government is committed to providing a swift and efficient process for the benefit of both workers and employers. Madam Speaker, this government is committed to minimizing employment injuries and occupational diseases, and on that premise, it is envisaged that a workers' compensation scheme should support and encourage accident prevention, as decrease in workplace accidents reduce expenses and entail higher productivity improvement due to fewer work interruptions. The intended outcomes from the completion of the labor reforms at the enterprise and industry levels include improved health and safety of workers, reduction of workplace risks and accidents, better productivity, higher worker skills level, better quality of goods and services, good industrial relations, job satisfaction, proactive risk management skills, sustainable in-house OHS management system, improved overall management practice, increasing productivity and profitability, and creating employment opportunities. Madam Speaker, in closing, I had highlighted in the beginning that this week we celebrate World Occupational Health and Safety Day on the 28th of April 2017. The theme for the celebrations this year is optimize the collection and use of occupational safety and health data. This mainly focuses on the critical need for countries to improve their capacity to collect and utilize reliable OHS data. Because if you can collect the information, if you can't collect the data, you cannot manage it. And that is absolutely critical. The theme also deliberates on the contribution to the implementation of SDG 8, Sustainable Development Goal 8, which provides for the promotion of inclusive and sustainable economic growth, full and productive employment, and decent work for all. This focuses on the protection of labor rights and promotion of safe and secure working environments for all workers, including migrant workers, in particular women migrants and those in hazardous employment. The Ministry, together with the tripartite partners and the ILO, have organized celebrations in all 3 divisions within the Northern Division, celebrating on the 20th April 2017, Western Division celebration, which will be held on the 26th of April 2017, and Central Eastern Division, which will be held on the 28th of April 2017. I urge the honourable members and members of the public watching from home to mark the remaining dates and ensure that they participate, as this is an opportunity to raise awareness on occupational health and safety on a national platform and examine ways in which we can offer better services to assist in the reduction of workplace accidents and deaths. I thank you, Madam Speaker.